Most independent practices invest in Creo and Tebra for a very specific reason: the promise of a simplified workflow. And on the clinical side, when the physician closes the chart, that promise usually holds up. But the friction starts somewhere between charge entry and ERA posting. It usually happens right when the person handling the billing is still learning the system, or when they suddenly put in their 2 weeks' notice. The moment that human operator steps away, revenue stops moving. Claims sit unworked, and the financial clock immediately starts ticking against the practice. This makes the billing process highly fragile. But the software itself is rarely the issue. The real friction comes from trying to run a specialized platform using a high-turnover workforce, all while navigating an increasingly complex payer landscape. Practice management software is an excellent tool. But relying on generalist, in-house staff to operate that tool has become the single largest point of failure for independent practices today. To understand why this fails, we have to look at what an in-house billing team walks into every morning. The current payer landscape is intensely hostile. This chart tracks the initial claim denial rate across U.S. healthcare. According to Kodiak Solutions, that rate climbed to 11.8% in 2024 and has held at those levels through the first part of 2025. The Healthcare Financial Management Association tracks a specific tactic behind these numbers. Payers are using initial denials to actively slow down payments. They ultimately pay roughly 90% of claims, but they force practices to spend time and money to overturn them first. The HFMA Pulse survey places the average net revenue lost to these denials at 4.8%. For a practice collecting $1 million a year, that is $48,000 walking out the door before anyone even notices. Payer rules are changing faster than any human operator can comfortably track. To win those appeals, a biller needs expert-level knowledge of both the software platform and the individual payer's logic simultaneously. When an independent practice tasks a generalist employee with fighting highly aggressive, specialized payer algorithms, they are setting themselves up for a compounding financial loss. The aggressive payer environment is only half the equation. The internal friction caused by staff turnover is equally damaging to the bottom line. MGMA data shows business operations support staff turnover reached 33.3%. 1 in 3 frontline workers leaves annually. Each departure carries a severe penalty, costing between $9,000 and $12,000 in recruiting, onboarding, and lost productivity. Then the practice enters the training spiral. It takes a full 60 to 90 days to bring a new hire up to full independent productivity on Creo or Tebra. During that 90-day ramp window, the daily workload piles up, denial queues get backlogged, follow-up calls to payers cease entirely, and accounts receivable begins aging. We see the direct result of this in Kodiak Solutions data, which tracks a 5.2% year-over-year increase in true AR days. That aging AR is the immediate mathematical consequence of an understaffed billing function. Every resignation letter forces the practice to restart a costly 90-day cycle of revenue stagnation. We call this the software plus expertise cap. Platforms like Creo and Tebra are designed to be user-friendly, but charge entry, modifier application, and complex appeal logic still require a highly skilled operator. Practice managers constantly report the same frustration. An employee spends months building deep institutional knowledge about the practice's specific payer mix, and then takes that knowledge with them when they leave. Practices underestimate this cost by only looking at base salary. Factoring in benefits, payroll taxes, PTO, and training, the fully loaded cost lands between $55,000 and $75,000. Furthermore, MGMA data shows these baseline costs are climbing sharply. Building and maintaining an in-house billing team places an unsustainable financial burden on the practice while offering absolutely zero guarantee of continuity. To solve this, a growing number of practices are completely outsourcing the function to dedicated specialists who live inside the Creo and Tebra platforms every day. The financial contrast is immediate. Instead of carrying a $75,000 overhead cost, Staffingly delivers the exact same function for a flat rate of $399 per week. That rate includes active AAPC and AHIMA-credentialed specialists, entirely eliminating the 90-day training spiral. Staffingly operates on a dedicated seat model. The exact same specialist works your account every day. They learn your specific payer mix, your denial patterns, and your clinical workflows. If a team member needs to leave, Staffingly's operational safety net activates. The seat is replaced within 48 hours. The practice never has to post a job, conduct interviews, or endure a ramp period again. The specialized model allows a practice to trade high-cost volatility for low-cost guaranteed stability. Staffingly also integrates AI-driven smart routing and automated auditing into the workflow. This ensures that sudden spikes in claim volume never cause a backup at the clearinghouse. AI handles the tedious monitoring and pattern detection. This frees up the human experts to focus their full attention on claims judgment, interpreting denial codes, and executing complex payer negotiations. The entire system operates under rigorous compliance standards, carrying SOC 2 Type 2, ISO 27001, HITRUST, and HIPAA certifications, protected by encrypted VPN access. The result is a highly precise operational baseline. Across their client base, Staffingly maintains an error rate below 1%. The onboarding establishes EMR access and maps protocols, initiating active billing work within a 14-day risk-free pilot window. Medical billing does not have to be a recurring operational crisis. It can be a fully optimized, fixed-cost function that you hand off once and never have to think about again.